let's introduce our next speaker. Actually has a pre-recorded talk. That's Ray Liu. Ray is a dear friend of ours, and he's a professor of orthopedics at Case Western in Cleveland, Ohio. He's the endowed chair of orthopedics at Rainbow Children's Hospital in Cleveland, and has also been the past president of LLRS, which is the Limb Lengthening and Reconstruction Society of North America. And the reason I invited Ray for the symposium was because he's had extensive experience with the sign, nail, and doing courses, especially in Northern Africa and Nigeria. So, Caitlin, if you could run Dr. Liu's pre-recorded talk. And Ray said he might be able to come for the discussion session. So we'll see how that goes.
Hi, everyone. I appreciate the ability to give this talk today. I'm honored to be included in a session with people who have done such amazing international work. And I apologize that I'm doing this on a pre-recorded basis. I look forward to the discussion. I have no relevant disclosures for this talk. So I started with international care pretty early in my career. I had written a study about the distal femoral growth plate and epiphysis, and we put it in one of our institutional mailers, which I didn't really expect anyone to actually read. But then I got contacted by Lou Zirkle. Lou is here getting an award from James Mattis for all of his international work through Sign Fracture Care International. And Lou asked me what I thought was a theoretical question at the time. He said, what would happen if you put a retrograde nail through the distal femoral physis? There may be some applicability to doing this type of an operation in some countries that don't have all the resources that we have. And my reply was that I had no idea what the answer was and that more study was necessary. And we went back and forth multiple times, and then we finally came to the point where we were doing basic science studies. I did them in Cleveland, and Lou helped advise on these and provide some of the implants. And you can see that this is one of our sheep that had an intramedullary object placed across their distal femoral growth plate. And we placed guidance K-wires within the epiphysis and metaphysis, which allowed us to watch how much the sheep were growing. When they were done growing, we sacrificed them and compared their two femurs and noted that in general, all of the sheep that had circumstances that you would actually do clinically grew without difficulties. I subsequently learned that these surgeries were being done in Mongolia on an ongoing basis throughout our basic science studies. Lou had tried to get them to stop, but he just couldn't. And that's why he really wanted to learn whether it was safe or not. I went and visited them in person, got a sense of how they were doing these surgeries, and then we studied their patients. Even though they had done over 100 surgeries, we could only get about 30 of them with good data. But those 30 all had good growth throughout the physis. There was no evidence of growth arrest in the ones that had adequate imaging to study. So that gave me some acquaintance to international work. And then I was approached by Rich Gelman, who is also very involved in Sign Fracture Care International. And he reached out to me at LRS a few years ago and asked if I'd be interested in joining him for a teaching conference in Nigeria. So we went together. Ken Thomas went with us. He's from Alaska, and we're there with one of our local hosts on the right, and on the left was part of the course. We did some live surgeries in addition to sawbones and didactics, but scrubbed there with Emeka Zwaba, who I've grown very close with. When I was in Nigeria teaching this course, it struck me that LRS, which is the Limb Lengthening Reconstruction Society, and an organization that I'm very involved with, had put a lot of effort into training some of these surgeons from Nigeria. Not necessarily purposely, but we had started a traveling fellowship in 2017. And when we first started, there weren't a lot of applicants. So there was room for Emeka and then Aniri before the year after to be part of our traveling fellowship. And this included 1 month of traveling to multiple limb deformity centers and trying to learn specialized techniques. Rich introduced me to the WhatsApp chat group that he had formed to help these surgeons. It's one thing to do a limb deformity surgery, but it's a whole different thing to follow that patient and do all the aftercare. And so this chat group allowed these surgeons the ability to show their pre-op cases and work through some difficulties along the way in terms of their aftercare. Initially, most of the advice was being given by surgeons from the US, such as John Herzenberg. But with time, we started to see this great development where the surgeons from Nigeria were giving advice to the other surgeons from Nigeria. So this was one such case where a patient came in with this terrible tibial osteomyelitis that they had when they were still young and growing, and they had developed this deformity into young adulthood and needed help. And so another surgeon actually had a similar case that looked surprisingly similar and had a treatment protocol that he had done with a reasonable result where the patient could get back to walking. And it was just spectacular to see them giving advice to each other and helping each other through these difficult cases. After my teaching course in Nigeria, I was a part of the presidential line at Limb Length and Reconstruction Society, and I asked myself and my fellow board members, what can we do to help LRS Nigeria succeed? There was a lot of interest in trying to help them because we saw how much great work Rich had done and how we had contributed a little bit, and we thought maybe we can do more here. And we also want to see if we could help other centers around the world develop, similar to what was going on in Nigeria. One thing that came to the forefront was that when we started our traveling fellowship, our goal with the traveling fellowship was to develop leaders in the US for our society. And we were moving towards that direction. We were getting, we had more publicization of our traveling fellowship. And really there was, most of our spots were being filled by US trained surgeons. But we saw the value of training surgeons from Nigeria and other countries. So we partnered with Sign Fracture Care International and asked them to help us both identify surgeons that they felt would be able to benefit from such an experience, and they also helped with the funding. And with that, we were able to train our first two Sign LRS traveling fellows, Henry Nadasi from Cameroon and June Valera from Philippines. Both of them are excellent surgeons. And I think they did benefit a lot from this 1 month experience. We saw a grant program come through AOS, and the goal of this grant program was diversity, equity, and access, and not necessarily international care. It wasn't actually specified anywhere that they had an interest in that, but we made an argument for that in our grant application, and they were kind enough to fund us. And so this funded one of our traveling fellows 1 year and also allowed us to send our two traveling fellows that year to the AOS annual meeting. In terms of continuing education, we all learned how to use Zoom. And so in 2020, we started quarterly Zoom sessions with our colleagues from LRS Nigeria. This is me with Reed Nichols and Jill Flanagan. The three of us get together with Emeka Zwaba and his colleagues. And what we do is we pick a topic every quarter. One of us gives a 5-minute primer talk so that everyone's at least on the same page, roughly. And then we start showing cases, and the cases that they show are just spectacular in terms of the amount of pathology and how much we can learn from them. Some of the benefits that we've seen with time is our colleagues in Nigeria training other surgeons in Nigeria and in neighboring African countries. So they have been putting on annual deformity courses, and really our goal was to train the trainers and make Nigeria kind of a beacon of limb deformity in Africa, which seems to be happening. We do what we can to promote their careers. It's helpful for them to give talks internationally. So I've invited Emeka for talks with the Limb Lengthening and Reconstruction Society annual meeting and for other things like webinars. We're seeing our colleagues from Nigeria around the world. This is at the POSNA meeting in Vancouver last year. And Emeka and Thomas, one of the other key players in Nigeria, are at this meeting. There's me with Sanjeev and some of their fellows as well. So overall, we're really excited in LRS in terms of our partnerships with LRS Nigeria and other centers. We think this has been our path towards contributing to global care. And again, really appreciate the opportunity to speak in this session.